Are you a pregnant or somebody that's trying to get pregnant, thinking about getting pregnant, postpartum, busy mom that is curious about what labor and delivery is all about? Are you curious about how to move in a way that helps you feel strong, have more energy, recover, in a less stressful, more joyful, enjoyable way, but still be able to be active, relieve aches and pains, all of these things related to the pregnancy, postpartum, and beyond journey? Keep watching because I think this might be the video for you. Hi everyone, I'm Dr. Sara. Welcome back to my YouTube channel. I am so glad you're here. So I am a family medicine physician. I am a wife, a mom of four, literally, we'll just, for posterity purposes, about to be five. Literally in just a few days as of this recording, the eviction notice is scheduled. So soon to be five, and an exercise enthusiast. And before we get into today's video, I just wanted to say again, thank you so much for being here. I would love if you subscribe, ring the bell, like any of the videos that you are inspired by, and definitely, come back for more if you are interested in moving in a simple way that keeps things uncomplicated, quick, can be done anywhere, anytime, and helps you see physical and mental health wins. So today's video was kind of inspired by, like I said, I have just a few days here before this baby is going to arrive one way or the other. And I was thinking about all of my pregnancy, labor, delivery, postpartum journeys so far. So like I said, this is number 5. I've had 4 full pregnancies and deliveries, and postpartum journeys incorporated all throughout that is ups and downs with exercise and movement and everything. And when my husband and I sort of joked around with our last baby that I have quite literally been around the OB world. I've had many different types of deliveries. I've had different types of interventions. And I think part of my inspiration for getting on social media and starting a YouTube channel is because, especially like with my first and second pregnancy, even as a physician, that's a family physician, which means I, as part of my training, did obstetric rotations, I delivered babies, I took care of pregnant patients. Even with all of that background knowledge and literally seeing it, right there, being the one delivering the baby, I still wanted more. I wanted more education. I wanted to know what to expect. And when I went looking for firsthand information from people that had done it, I just felt it made me feel almost more alone. Somehow, everything I found, or not everything, but a lot of what I found was women that looked like they had it all together. They had makeup on, they had their hair done, it was like a perfectly smooth process. And I just felt like I wanted to come on and sort of share the reality of how things were for me. Because I think, with my expertise as a physician, but then also as a mom that is passionate about movement, but also has had many different types of things done obstetric wise, I sort of have this unique perspective. So basically the point of this video was just to kind of give you a brief summary of the types of things delivery wise and postpartum journey wise, and then kind of get feedback as to if you guys would want individual videos for each of my deliveries with more detail and my experience, mental health wise, physical health wise, recovery, movement, like all the things. So if you do want to hear more, comment message me, thumbs up the video, watch the whole thing. All of these things somehow indicate to me that this is definitely a topic that you want me to expand on and explore. So, like I said, just to sort of summarize, my first delivery was a scheduled induction I was 41 and a couple of days, 41 weeks and a couple days. So at that time, if you were having, a fully healthy pregnancy, they basically would typically schedule induction, at least my OB did, somewhere between 41 and 42 weeks. Things have changed a little bit, or at least the OB I see now does things a little bit differently. And I should have said, caveat, obviously, if you're pregnant, postpartum, trying to conceive, all the things, and you have specific questions about your situation, your health, you definitely want to schedule and talk with your personal OBGYN physician about all of that. None of this is intended to be like medical advice. It's just kind of sharing my story to hopefully help some people feel less alone during, these very delicate journeys that we experience. So the first one was a scheduled induction. It was a, 3-day affair in the hospital. I did have an epidural. It was multiple hours of pushing. That was that delivery. Ultimately, everybody was healthy, all of that, but it was a very long induction. My second delivery, I went into labor on my own. It was barely made it to the hospital, no epidural. Like, it was truly a miracle that I delivered inside the hospital. Very rapid, very what's called precipitous in the medical world. And like I said, no epidural. So obviously those two deliveries were incredibly different, and the recovery was incredibly different. And those were both vaginal. I don't want to make any assumptions that so those were both vaginal. The third delivery was I think I was about 39 weeks. I started having contractions at home. We lived where I am right now, where we live now, which is quite rural, and it takes 45 minutes to get to the hospital where I would deliver. So, of course, there was a lot of stress and anxiety with any contraction I had at home, because with my history of the second delivery being incredibly rapid, we obviously wanted to make sure we were at the hospital with plenty of time to spare. So I had been having contractions most of the day. They weren't terribly regular or painful, but they weren't letting up when I sat down or rested or drank water or any of that. And so it was like, well, with the distance and all of this, we're going to just go in and get checked out. Because of where I was at in the pregnancy, and then the baby had one little heartbeat situation while we were there, they decided to just keep me and induce me overnight. In short, or as short as I can keep it. And like I said, if you want full videos on each of these, I can certainly, do that if there's interest there. But so this one, ultimately, we got the induction going. Things weren't really happening. Figured out baby was no longer head down and had flipped to what's called a transverse position. So they were kind of lying, head, spine, bum this way. Then ended up having what's called an ECV, or an external cephalic version, which is the medical way of saying the doctors basically attempted to turn the baby back to head down, which was successful. They continued the induction, but ultimately he just was not interested in coming out that way. So that ultimately ended in a C-section. So again, totally different experience, totally different recovery. I have a lot of things to say comparing those three. My fourth was also a scheduled induction. I was halfway between 39 and 40 weeks. I was having contractions here and there leading up to it, but nothing that was like go to the hospital type of stuff. We went in. at night. They started the induction, with what is called a balloon catheter, which I can go over that again if there's questions or interest. But basically, they use it's like a Foley catheter, or a catheter that they insert into the cervix and then they fill it up. And so the balloon sort of helps start the process of expanding the cervix before they can use some of the other medications effectively. And that also has to do with me having had a C-section for the third. So when you're trying to do a vaginal birth after C-section, which is also known as a VBAC, if that is the goal, there's certain medications that can and cannot be used due to the history of a C-section. And so my OB at that time felt comfortable with me attempting to try to do a vaginal delivery. It was absolutely wonderful. It was, an induction exactly how you hope it would go. I did have an epidural with that fourth baby. It was like, 15, 20 minutes of pushing, just one of these deliveries where it was like compared to the previous three, significantly, again, different in terms of the experience, the recovery, all of that. And all this, and then of course, number 5, keep you posted. We'll see what's going to happen here. But I think all of this to say, I would not change any of the deliveries that I had. I think that all of these experiences have, basically contributed to the version of myself that I am today. And I think that they have grown and developed me as a human, as a mom, as a doctor, as a wife, like all of these things. And so I wouldn't go back and change anything at all. I think that, I'm very much a believer in things happen for a reason. And I think that part of that is for me to share information that is, medically correct. And also that, things happen and you can't always have a set plan going into labor and delivery. I just kind of off topic here, but I never really had a set birth plan. My plan was always healthy mom, healthy baby, no matter what. And there were a few things that I was like, oh, I would really like that, but it was all stuff that every hospital I delivered at, it was like standard of care anyway. Things like, the baby rooming in with you and skin to skin immediately after delivery if it's safe and possible. Like these things that are just inherent now, which is absolutely wonderful in hospitals. But I am the type of person where I knew if I had like a printed out version of my birth plan and then something didn't go according to the plan, it was going to be worse than me just kind of showing up and going with the flow. So I think that's also hugely important, definitely to think about ahead of time, but to know yourself and to maybe talk with people that are close to you so that, because they know you and they can maybe also help point some things out. But I think just really taking the time to think about your personality and how you might react if things are not going according to the plan that you create. And so I knew for me, I needed to just kind of show up, go with the flow, and that is what has, worked out wonderfully for me over all these deliveries and all these years. As you know, if you've watched any of my YouTube videos or my social media content, I am incredibly passionate about movement. And so I have been, active throughout my pregnancies and, incorporated movement into my postpartum journeys. And so if I make individual videos, I can certainly explain, that process through all the deliveries. So if you are somebody that is interested in learning more about this, again, if you're somebody that's wanting to have more energy to play with your kids, have less aches and pains, feel less stress, less anxiety, less overwhelmed, and move in a simple, uncomplicated way, but also still see physical and mental health wins, definitely subscribe here so you don't miss any of my videos. And you can also head over to my website, which is drsaraionescu.com, and sign up for my VIP email list, which is going to be, an exclusive area for updates, extra content. You'll be the first to know about if I'm doing any live or virtual workout events, this sort of stuff. So, imagine if you are somebody that's thinking about getting pregnant, you are trying to get pregnant, you are pregnant, or you're, postpartum or beyond, really, because postpartum is it really anybody that's ever had a baby. Like once you have had a baby, you are postpartum forever. It's just how long, since your delivery. So if you are any of those people and you're imagine if you could connect in a community or just by watching these videos and feel, supported through this journey in a way that feels, real, honest, medically appropriate and correct. And how awesome would that be? And then you can also figure out how to move in a way that feels doable, that feels, like you can incorporate it into your family. And it's not increasing your stress, it's actually decreasing your stress and helping you and everyone in your family feel better. I think that would be awesome. So definitely come join me on this journey. All right, everyone, thanks for watching and thanks for your support. Bye.